Back from the store. Still have a little time left. Not much before I have to go to work. But let's go do something. At least let's make it to the office. Man.
Good evening, Mr. Fiddick.
Good evening, Dr. Reid. Any news about my operation?
Did I unlock anything for you? No.
Goodbye for now, Mr. Fiddick. I'll see you later.
Sweet girl. Reads me like a book.
The other doctor.
Good evening,
No.
Dr. Strickland.
And good evening to you, Dr. Reid. Can I be of any help?
No. You can't.
Goodbye, Dr. Strickland.
I will not let you down, my boy.
I'm alright. Don't waste your time with me.
Anybody? Oh, hello. Were you here the whole time?
Good evening, madam. Can I help you?
It's my son who needs you, sir.
I'm Dr. Jonathan Reid. How can I help your son?
I'm Beatrice Goswick, mother of Mortimer Goswick. Could you check on him, please, Dr. Reid? I've heard much of your talents as a physician.
Let's get some information.
What can you tell me about yourself, Mrs. Goswick?
Not much to say. Just take care of my Mortimer and I'll cover all the expenses. That's all that matters.
Well, she's rich.
Are you really that rich? Most of the patients here are of a more humble origin, if I may say so.
Yes, thanks to my husband. May he rest in peace. I can cover any needed medical expenses.
Well, that's good to know. Write you up a nice big fat bill.
May I ask if you have an occupation, Mrs. Goswick?
I'm a teacher by profession. I teach young women who are more ambitious about their futures than their families.
Ah, good for you, lady. In those times, it's very good.
What do you think of your reception here? Any complaints?
I have had the uttermost reservations about this hospital since we arrived. But we had no other choice, considering the state of emergency.
Is there something in particular that's bothering you?
Some of the staff were not especially welcoming. I suspect they're not accustomed to dealing with patients of such social standing.
Tell me more about your arrival at the Pembroke Hospital. What gave you such a bad first impression?
The ambulance driver was quite rude, for a start. And that nurse, Miss Hawkins, seems to have quite a dubious attitude.
What do you mean?
She managed to secure a bed for my son despite the epidemic. It was a relief, but it wasn't cheap.
Ooh, that's not okay.
She charged you for a bed?
Yes, and I paid without question, considering the urgency of the situation.
We need to find Pippa again.
I share your concern, Mrs. Goswick. Be sure that I'll talk to the people involved.
I don't expect compensation, Dr. Reid. But I'm aware such behavior would not be tolerated in other hospitals.
I think she took the money for herself. We'll get to the bottom of that. Man, there's a lot to do here. Well, I guess this is our home now, so see if we can get it fixed.
You always knew the words to calm.
Pippa was the nurse that seemed nice. Oh, where can we find her?
What can I do for you, Doctor?
Oh, this is Dorothy. Sorry, wrong nurse.
Thank you, Nurse Crane.
Yeah, you're the other doctor. Been looking for
Good
you.
evening, sir. I'm Dr. Reid. I believe we're going to be colleagues.
Reid, yes, I've been informed about your arrival. I'm Waverly Aykroyd. Welcome aboard, I suppose.
Does my arrival inconvenience you in some way, Dr. Aykroyd?
Let us just say that I don't particularly share Dr. Swans's enthusiasm for hiring you. What we need here are reliable professionals, not overrated dabblers.
Wow, I feel so welcome here.
It seems you have bad memories of your military service.
I refuse to see this industrial slaughter as scientific progress. War only reveals the worst in men.
We can at least agree on something, Dr. Aykroyd.
Yeah, Dr. Dan Aykroyd. Be cool.
I don't know what you've heard about me, but I have already proved my value as a practitioner.
I don't question your skills, Dr. Reid, but your motive. Is it money, fame, or are you truly dedicated?
And what exactly is that supposed to mean?
I served in the war just like you. But unlike you, I did not use the wounded to play the modern sorcerer.
Be careful what you insinuate, Dr. Aykroyd.
I only want you to admit you used those men to improve your theories.
So angry, dude. Relax. Part of the same team,
This
sort
is
of.
ridiculous. My blood transfusion technique saved many lives, and you know it.
You see? That is exactly what I hate about people like you. You avoid this kind of accusation instead of facing reality.
So much anger.
Since your tenure in this hospital is longer than mine, perhaps you can tell me more about this place.
Let's just say I'm tired of the carelessness around me. I have always respected the skills of Dr. Swansea, but over time his enthusiasm has become displaced.
Carelessness? Exactly what are you talking about?
We're here to save lives. The people who trust us are not volunteering for experimentation. They're here to be healed.
I don't intend to run any radical experiments, Doctor. Even if I, as any good practitioner should, express an interest in pushing the boundaries of medical research.
Modern medical methods were created through audacity and ego. But there are rules in our line of work, and they're here to protect our patients.
What else can we ask this dude?
Tell me, Waverly, what do you think of Dr. Strickland's enthusiasm for his experimental research?
Strickland is playing with his patients' lives for pride and glory. Now that, sir, is unethical.
Are you thinking about something in particular?
Harvey Fiddick needs delicate surgery. I believe we should stick to the usual procedure, but my young colleague obviously disagrees.
So, tell me how you really feel.
Why do you wish to lead this surgery?
I strongly believe that Mr. Fiddick should not be butchered to test an unproven procedure.
Other
Tricky.
people may say that's too conservative a point of view.
Conservative? And what are you going to say to Mr. Fiddick if he loses his arm because of the operation? Because that's what's going to happen if the surgery is a failure.
And are you not afraid that your rivalry with Strickland may be blinding you?
Rivalry? I guess you could call it that. But I will never be childish enough to let my personal feelings affect my judgment.
These doctors here are very twitchy.
If you have a problem with me, Dr. Aykroyd, please feel free to tell me.
Dr. Swansea has imposed your presence on this hospital without asking anyone's advice. The benefit of his position. But I don't agree with it.
I know we've never met before, but I believe this hospital could use all the help it can get. You will agree with that, I'm sure.
Oh, but I have heard about you, Dr. Reid. Of course you can't say the same about me, since I have not wasted my time courting the press.
Oh ho ho! Jealous, are we?
Aren't you too old for such jealousy? It really won't do you any good, you know.
Don't be ridiculous, Dr. Reid. A simple glance is enough for me to know you have nothing for me to envy.
Well...
Thank you for your time. We'll talk later.
Guess we learned enough from this dude. Okay, so Pippa's on the list. Because he took money to take on a patient. Somebody here as well.
Good evening. I'm Dr. Reid.
Always a pleasure to meet a colleague, sir. Especially when he was supposedly dead.
A colleague? Are you a doctor too?
Not anymore, sir. I used to be Dr. Rakesh Jadana. Now, I'm just Mr. Jadana, pawnbroker and humble guardian of this morgue.
What do you mean? You used a doctor? Was your license revoked?
No, sir. It is just that I like to be precise. I run a little pawn shop while taking care of the dead. But I used to be a real doctor.
Oh. That's a very different...
A pawnbroker? I expect you get all types of people here.
Yes, sir. All kind of people. For I sell all kind of goods.
Why did he do that? Why did he stop being a doctor? Something must have happened.
Who comes here to trade with you? It's very unhygienic, even unsafe. Diseases can spread. For the customers, for the hospital.
I'm very cautious, sir. I've been a doctor, remember? And all my clients are good people. In fact, I think I only know good people.
Oh, that's strange to say.
What kind of goods?
With the quarantine, it's not always easy to buy things. So I trade, I exchange. Some people sell, some others buy. I like to help.
Yeah, he's our shop. Hint, hint. Oh, everything's locked off.
Are you afraid or uneasy being surrounded by so many corpses?
Why should I? These bodies are empty vessels. Flesh left to decay. Poof. No soul anymore. All gone.
Okie dokie.
An interesting point of view. And quite an exotic one, too. Most people fear, or at least have a respect, for dead flesh.
Sir, as a medic during the war, I learned to face my death and the death of others. It's the pain we have to tame, not death itself.
That's actually quite smart.
How did you get this job?
After I left the army, I worked as an undertaker down by the docks. A dangerous place with many an unpleasant business there. Milton Hooks helped me get a job here.
Alright. 2 more to go.
Do you work here alone?
Yes, very easy work, sir. All I have to do is watch a few bodies. The situation was very different when the main morgue was still open.
Why is it closed?
Why do you have to watch these bodies?
Because these poor fellows have no names. We keep them in case someone comes looking for the missing. Sadly, very rarely happens.
Why close the hospital's main morgue?
It was for sanitary reasons after the beginning of the epidemic. Cadavers had to be moved to the nearest mass grave.
Oh. Have we met before? That's a good question.
Have we met before?
I don't think so, sir. Why?
When we first talked, you said you were glad to meet me since I was reported dead.
Funny story, sir. Your sister came here a few nights ago. You were missing, and she was looking for your body. She must be very relieved now.
Well... See what he has in the shop?
Please show me what you have to sell.
Of course. It's just trinkets and curios, really. But I'm sure they can be useful.
I have some money. Should we just buy some stuff? At least something. We don't have that much money. Formula. I'm interested. Alright, we've done some shopping. Next up, let's head to our office.
It's locked, all right.